Arkansas's U.S. Senator Tom Cotton joins me on the line to talk about health care and gun control. Thanks for your time, Senator.
Thank you.
There have been many repeal votes on the Affordable Care Act since it became law. The latest is a little bit different. A repeal measure is actually making it to the president's desk. A veto pen is assuredly waiting, though. Does this vote signal anything different to you about the political climate?
For the first time, the president will have to sign his name on the dotted line to veto a bill that would repeal Obamacare, and I think that crystallizes just how committed the Democratic Party is to defending this law that has been largely a failure, that's driven up the cost of many people's health insurance and also led to declining quality for many people as well, for some businesses out of the industry altogether. So I think it will frame the issue very well for this coming election, that Barack Obama and the Democratic Party is committed to government-run health care in a one-size-fits-all model that simply doesn't work in a country as diverse as ours. Republicans, however, will focus on health care that works for patients and families, for doctors and communities in our state, in Arkansas, and all around the country. And then we'll have an election in November, and I think you'll see major changes coming next year. But I think this legislation frames the issue very well.
All right, let me try and set you up against Arkansas's Governor Asa Hutchinson a little bit on this issue. The governor has asked the Republican legislature in the state to continue Medicaid expansion with some type of changes this spring. The governor wants what he calls Obamacare repealed, of course, but he insists that Congress should find some sort of transition or something for the 30 states that have expanded Medicaid already. This latest repeal effort didn't seem to have much like that. So what would your alternative be for those 200,000 plus low-income Arkansans on the program now?
Part of the failures of Obamacare is that it cost millions of Americans health insurance that they wanted, that they had, that suited their purposes well. Governor Hutchinson and our legislature is working with a Medicaid program that reflects many of the exact flaws I mentioned earlier, the kind of one-size-fits-all program that's managed from Washington, D.C. As part of repealing Obamacare in the future and replacing it with health care that will focus on the needs of patients and the great diversity in our country, what I would like to see is a lot of the strings and the red tape of Medicare or Medicaid cut, so Governor Hutchinson and our legislature can work to address the needs not only of the new Medicaid recipients, but also all the people who have been on Medicaid for years in Arkansas, because our state is very different from a state like, say, California or Florida or Maine, and our legislators and our governor should have the ability to craft a solution that fits our state. They shouldn't have Washington bureaucrats tying their hands.
But fundamentally, do you think that Congress should provide federal dollars to cover people who earn up to 138% of the federal poverty level?
Well, I think in a country as big and as prosperous as ours, we want to make sure that we take care of those people at the margin of societies who have maybe lost a job or who have a serious illness that they can't otherwise get coverage. But we can do that without Obamacare. We've had a lot of programs on the books before Obamacare, like Medicaid or the state children's health insurance programs. We need to reform those programs to provide more flexibility, to provide governors and legislatures more opportunity to care for them. We don't need Obamacare dictating the choices that our states have.
I've been speaking with U.S. Senator Tom Cotton of Dardanelle. Thanks a lot for your time, Senator.
Thank you.